Shasta Community Health Center, serving Redding and the surrounding communities, is a nonprofit primary healthcare system ranked among the top 1% of health centers nationwide. Our mission is to provide quality healthcare services to the medically underserved populations of our communities. Our healthcare center is recognized as a National Health Service Corps location, which can provide medical school debt forgiveness. We strive to create an educational environment for the training of medical professionals dedicated to serving the disadvantaged from cradle to grave. We offer residency programs in dental care, pediatric care, and primary care, including pain and palliative care.
The thing about Shasta Community is we have it all. We have from the young working family that's got the little children that are just trying to get by, to the people who have disabilities and can't work, and you need to learn to have compassion and understanding for all of that.
The reason we actually decided to start the residency program is that this is a great place to train. We're a big safety net clinic, and so the patient opportunities are huge. We work with pediatricians, psychiatrists, the homeless. We get to go out and work with the homeless. It's just a really good training opportunity.
The program itself comes from myself and my colleagues that have graduated programs, and were just let loose. And really, it was very challenging. In the first couple of years, it was a very difficult process. There are a lot of other professions that have residencies, and we just decided that we do want to have new graduates at Shasta Community, but we want to make it a positive experience for them. And so that's where the program began to develop.
Our accredited rural training program in family medicine provides significant exposure to obstetrics, pediatrics, procedures, and homeless and community medicine, and shares inpatient training rotations at Mercy Hospital. We also have a nurse practitioner and physician assistant postgraduate fellowship program. Benefits include a moving allowance, health, dental, and vision plans, renewal of medical and DEA licensures, an American Board of Family Medicine exam allowance, and more.
The greatest benefit is that it's a slow transition into a regular clinical practice in a way that is not as stressful as if you just got out there as a new provider. The one thing that we're also emphasizing in this is that you learn how to be an efficient clinician, to be the leader of a team, and how to work in that patient-centered medical home model to provide that well-rounded care for the patient. And the only way you can learn that is to be on the floor and doing it. You can learn it in the books, but until you're actually doing it, that's the best training, and that's what we hope to do.
As a new grad, it's really scary going straight from school into practice. So having it be a fellowship program was a big selling point. It's hard to take care of somebody if you're not confident in what you're asking of them, but it's hard to have that confidence if you've never done it before.
We have a very broad-based focus on health. It's not just about the patient in front of us, who's very important to us, obviously. It's about the community's health, the broader issue. And we feel with the 60,000 patients we take care of in this county, we can make a difference in serving that part of the population. We can raise the bar of health in our whole community. That's the way we look at it.
The diversity of patient care opportunities is substantial, offering residents significant training and advancement potential. In their free time, residents will love the Redding area for its sunny weather and limitless recreation opportunities, including lakes, rivers, and national and state parks.
As an underserved area, we always have a need for primary care providers. So the goal is to train residents who want to stay here and to provide care for our patients.
I love teaching. I was super excited about the opportunity to start the residency program. I get to work with students and residents, and it's really fun to watch the residents, start as scared intern to leave here, third years who know what they're doing. So that's just a great process.
particularly for a young doctor or nurse practitioner or PA who's going to be learning a tremendous amount at the beginning of their careers. You're going to find a very supportive environment for you here.
If you're ready to join our efforts, serve your neighbors, and advance your education, join us in Redding, California. For more on the Shasta Community Health Center Family Medicine Residency Program and NPPA Fellowship, including how to apply, visit shastahealth.org.